Today we're going to be discussing clinical nutrition in dermatology. My name is Dr. Rachel. Hopefully you're getting to know me by now. So today, clinical nutrition in dermatology. The things we are going to talk about, we're going to start as ever with some definitions. So definitions in dermatological conditions. We are going to look at the clinical workup, and then once we've got our clinical workup underway, we can look at how nutrition can help in various skin conditions. So to start with dermatosis, then in cutaneous adverse food reactions, and then finally in atopic skin disease. So definitions of some dermatological conditions. A little bit of background to skin disease and skin in general. As you probably know, skin is the largest organ in the body and it counts for up to 24% of total body weight. It's got three main key functions. The first is integrity, so it's the physical structure. It provides protection, it forms a barrier, and what it does, it keeps fluid in and it allows the body to exist in its own environment. Secondly, immunity. The skin has actually got its own sort of immune system. It helps keep environmental allergens out and helps maintain skin health. And then finally, pigmentation. So obviously the different colours of the skin, the different colours of the coat. And I don't know what your experience might be in practice, but they think that skin disease accounts for up to 20% of the caseloads in general or first opinion practice. So that's 1 in 5 patients walking through the door. I know in the UAE, in the Middle East, because of the climate and the air quality, a lot of people feel that it's actually more than that, that actually exacerbates those statistics even more. So whatever way you look at it, whether it's 20%, whether it's 25%, it's a huge number of patients. It can be a very, very frustrating conditions to deal with, skin conditions, and nutrition can be really, really helpful. So a few definitions. Dermatosis, this refers to any disease of the skin or coat. Dermatitis, you know that itis refers to inflammation, so dermatitis refers specifically to inflammation of the skin. And pruritus is just the medical term for itchiness. So just to look a little bit at the anatomy of the skin, you can see from the diagram there that we have got 3 distinct layers. We've got the epidermis, the dermis, and the hypodermis. So the epidermis is the outer waterproof layer of the skin. It's composed of about 5 layers of dividing cells, and they're constantly shed and being replaced. So obviously they sort of start here where new cells are produced, and as they divide, they move upwards, and then they're shed off the skin surface. So this is obviously the skin surface, and then this is the deep tissue here. Now the epidermis of dogs is about 3 to 5 cell layers thick, whereas humans are actually about 3 times that, or up to 5 times that, so 10 to 15 cells thick. So humans literally are thicker skinned than dogs are. Now the epidermis is composed of different types of cells. So you've got keratinocytes, melanocytes, Langerhans cells, and Merkel cells. And this is obviously where keratinization occurs. The Langerhans cells are part of the immune system, and they play an important role in detecting environmental allergens. And then the Merkel cells are actually associated with a lot of the hair follicles, particularly the whisker follicles. And they actually provide sensory information from touch through the whiskers. If we move down to the dermis, the sort of middle layer here, the dermis contains tough connective tissue. It's got the hair follicles and the sweat glands, obviously in the places where sweat glands are actually found in animals. Blood vessels are found here, and it's this layer that supports and nourishes the epidermis. So this is where the full sort of blood supply is, which then nourishes the epidermis at this level. Moving deeper still, we go into the hypodermis. So this is the deeper subcutaneous tissue. It's mainly made of fat and connective tissue. And you may also hear it being referred to as the subcutis. So a couple more definitions. Cutaneous adverse food reaction. This is a non-seasonal pruritic skin disorder of dogs and cats associated with the ingestion of a substance found in the animal's diet. We've then got atopic skin disease. a genetically predisposed inflammatory and pruritic allergic skin disease, often associated with the production of immunoglobulin E against environmental allergens. Okay, so they're quite specific definitions, and we'll see why that's important as we go on. So just looking at this other diagram of the skin, another just way of looking at it. So again, you see here, this is the epidermis, the dermis, so you've got your sweat glands here, you've got your nerves, your nerve endings. You've got your hair follicle here, associated sebaceous gland, your piloerector muscle, which is what makes the hair stand on end. And then moving deeper, you've got the hypodermis here. So what causes skin disease? Well, this is a potentially almost unending list. So what we've done here is just produce a list which is hopefully just covering all the major categories. So we start by thinking about infectious things, so bacterial, viral, parasitic, mites, fleas, fungal, such as ringworm. We've got allergic skin disease, so flea allergy, food allergy, environmental allergies or atopy. Adverse food reactions, we've got autoimmune disease, endocrine disease such as hyperadrenocorticism, hypothyroidism. So sometimes with these, for example, hypothyroidism, what you can actually often see is just recurrent pyoderma. That can be one of the main presenting signs, but actually, it's got an underlying cause. Congenital skin disease, obviously traumatic skin disease. I've put in psychogenic skin disease, things like lip granulomas. So these may start, sometimes you see them in sort of older arthritic animals, particularly dogs, where what they do is they actually lick at the joints which are sore, which are feeling achy. And unfortunately, because the dog's tongue is obviously quite rough, what it does, it creates sort of mild abrasions, if you like, on the skin, and you get this lip granuloma, which is then irritating, and so then they keep licking at it. So, and it becomes almost a sort of a psychological urge for the dog to lick. So, some people either strip bits of their hair out, some people pull at their eyelashes, pick their nails. It's that kind of psychogenic urge. But as we say, it results in a skin disease. So just makes you think there are so many different causes of skin disease out there. And then finally, we've got neoplastic skin disease. So when our itchy dog or cat walks in through the door, we know we have to start on some kind of clinical workup to discover what's actually causing the itch, what's causing the skin disease. So obviously, we're going to start with our consultation, with our clinical history. Always think about your food diary being included in this as well. It's obviously worth noting as well, if you do find that a home-cooked diet, a vegetarian or vegan diet features in the food diary or in the history, just remember they may be low in protein, they might be high in phytates, lacking in omega-3s, particularly if you've got a vegetarian or vegan diet, which can all contribute to sort of poor skin quality or poor coat quality. Within the consultation, think about doing skin scrapes, plucks, hair plucks, tape strips, swabs, for microscopy, for culture. So all sorts of things, you can get clues as to what is going on in this patient. Think about blood work, things like your endocrine diseases, your hypothyroidism, your hyperadrenocorticism, biopsy for histopathology, ectoparasite control. Mainly here we're considering fleas. I know fleas aren't a major problem in the UAE and in the Middle East, often because of the heat and because of the lack of sort of vegetation in the environment, essentially. So fleas like nice shady damp places which are warm but not too hot. So you can see that the desert doesn't really fit with that so well. But you have also got to think about things like ticks, mites as well. And then finally, once we think about all of those, covered all of those bases, that's when we then look to our elimination food trial. Now, The truth about skin disease is actually the appearance of the lesions may be very similar in many cases without actually being pathognomonic for a particular condition. So the skin's basically got a standard response if it's damaged, but this won't indicate what the primary cause is. So do not feel like when a dog or cat walks through the door with the skin looking in a particular way, you should instantly know the answer. The only way to diagnose skin disease is to investigate, because gross examination can be really, really misleading. Always remember, bacterial and fungal disease can often be secondary, and simply treating this won't resolve the underlying issue. So it's like when we spoke about hypothyroidism, recurrent pyoderma, just treating the pyoderma, it's just going to keep coming back. And what you get is then a case of a very irritated owner who keeps coming back and is extremely dissatisfied. Yeah. So these secondary infections are just sent to complicate the diagnosis for us. So if you look at a couple of these images, so take the first one. This is an image of pyoderma. You've got numerous papules and pustules. The lesions are all at sort of different stages on the skin. However, the underlying cause of this one was actually contact dermatitis. If you take the third image, what can we see? We've got hair loss, we've got erythema, we've got sort of raised, demarcated edges, possibly a bit of crust. So, you know, what could this possibly be? It could be all sorts of things, yeah? We're thinking histiocytoma, neoplastic, maybe ringworm, but we can't differentiate between those unless we actually do the scrapes, do the biopsies, do the plucks, and actually investigate further. So, how can nutrition help? We're going to start, there are 3 different sections on this. We're going to start by looking at nutrition in dermatosis. Now, remember, dermatosis is any disease of the skin or coat. Okay, so just bear that in the back of your mind as we're speaking, and think about any disease of the skin or coat. This is how this type of nutrition can help. So this is your decision tree from Royal Canin for your dogs. If you look over here, we're looking at dermatosis and hair loss. Okay. Under dermatosis, you can also consider infections, external parasites. So things like, you know, your pyoderma, things like your fleas, you know, livestock cocties, whatever. So all of these we can consider to be dermatosis, any skin disease. If we look down to the diets we've got available, we've got skin support listed here. We have actually had a problem, you're probably all aware of by now, with manufacturing of skin support. So there was a COVID-related problem with the availability of one of the raw ingredients, as I understand it. And so at present, we just have skincare in stock. They're broadly very similar diets. So if you have got clients who are on skin support still, you may well already have been moving them over onto skincare, but skincare is really where we're pushing towards now. There's the decision tree for the cats. It's a little simpler in cats. There's just this one diet, skin and coat, for your dermatosis. So if we look at how we can use nutrition to target the skin and coat, what are our general considerations? Well, let's start by thinking about the hair. The hair is made up of 95% protein, and of that, it is mainly keratin. Now, for good keratin synthesis, foods needs to have a high percentage of sulfur-containing amino acids. So there we're thinking of methionine and of cysteine. Now, the daily protein requirements for skin cell renewal and hair growth are estimated to be around 30% of daily protein intake, which sounds like a lot, but actually when you think about it, if we're saying that skin is the largest body organ, you know, it's 25% potentially of the body weight, and it's covered in hair, right? Absolutely covered in hair. So that's why you've got this really high percentage of daily protein intake being fed into skin cell renewal and into hair growth. Now, the primary consequence of an overall protein deficiency is a decrease in hair diameter and in hair bulb size. So you may get sort of reduced hair growth, you may get finer or coarser hair and brittle hair, which will break more easily. Just again, a quick mention, just beware if you do have clients who are feeding vegetarian or vegan diets, it is very, very hard to get the appropriate amount of protein, and particularly these sulfur-containing amino acids in these diets. And so you will be able to see this reflected in these animals' coats. If we think about one of the key functions of the skin, part of it was pigmentation. So how can we support pigmentation with nutrition? Well, again, we're thinking about protein. So hair color depends on the deposition of melanins from melanocytes in the hair shaft. Okay, and follicular melanocytes produce two different types of melanin. We've either got black eumelanin or brown pheomelanin. And the proportion of one to the other, of eumelanin to pheomelanin, is controlled by tyrosinase. And the activity of tyrosinase is directly stimulated by an amino acid called tyrosine. And if you've got more tyrosine, you've got more black pigmentation. So conversely, if you've got not enough tyrosine in your diet, areas that should be black may well be more brownish, okay, as you can see in this nice picture here. It's taking me ages. I still can't figure out which bit of the dog this is. I think it's its back. This is its tail here. This is its spine coming down here. So I think it's sort of sitting down, and this is its back. But you can see it looks like a German Shepherd dog. So this is likely, normally would be all sort of very deep black. But you can see you've got this almost sort of sun-kissed effect. And this is because the animal wasn't getting enough tyrosine in its diet. So remember, another major function of the skin is integrity. So the skin integrity, or the barrier function, is one of the key important functions of the skin. So what the barrier function does, it prevents moisture loss from the internal to the external surface. And we term this transepidermal water loss, TEWL. And conversely, what it also does is acts as a barrier going in the opposite direction as well. So you're preventing environmental allergens from entering from the external to the internal surface, okay? And this barrier function can be disrupted in many dermatoses, and it's almost independent of the cause of the dermatosis. Now, if we think about the structure of the stratum corneum in the epidermis, what you've got these corneocytes, and then in between the cells, you've got these lamellar lipids. So these are ceramides, cholesterols, free fatty acids. And we try and think of it in your heads as a bit of a brick and mortar, so a bit like a brick wall. Now, a good stratum corneum, a normal one, should look something like this. But if this barrier is disrupted, you may get more of this appearance. And if you've got more of this appearance, then there are these bigger gaps through which water can wiggle on through and be lost. And the other way, you've got these bigger gaps which allergens can wiggle through and gain access to the internal environment. Okay? They've actually found in atopic dogs, you get wide intracellular spaces, and you also get disorganized lamellar lipids, which contributes to sort of a disruption in this barrier function, which is why in atopic dogs, they're more susceptible to external allergens penetrating through their skin and stimulating their immune system. There's also been a negative correlation between the amount of ceramides. So remember, ceramides were in this, in the lamina, in the cement, if you like, lamellar lipids. So a negative correlation between the amount of ceramides and the transepidermal water loss. So there's less ceramides, you get increased transepidermal water loss. And so taking that, they've actually, in the research, transepidermal water loss is now widely used as a measurement for how well the skin is actually functioning as a barrier. So how do we actually use nutrition to maintain this integrity? How can we support the brick wall function, if you like? So if you think back to the first lecture and think about omega-6s and omega-3 fatty acids, you'll remember in both dogs and cats, linoleic acid, so an omega-6, is essential. It can't be synthesized by the body. In cats, arachidonic acid, another omega-6 fatty acid, is also essential. Yeah? So these are two omega-6 fatty acids, which are essential fatty acids. And what these omega-6s do, they actually improve hair coat quality and they improve the intercellular cement. Okay, so they're improving the epidermal barrier function. Good sources of this are safflower and borage oils. Now, your omega-3s have got slightly different function. Your omega-3s are things like EPA and DHA, and those have got anti-inflammatory properties. You tend to get really good sources of those in fish and crustacean oils. Okay, so fish is often in the fish oils are often in food. Crustacean oils, often green lip mussel (GLM), are often in some food supplements. So omega-6s, as you say, they improve the intercellular cement, improve barrier function. Omega-3s help control pruritus and inflammation. So we'll look a little bit closer at the omega-3s. As you say, EPA, DHA have got anti-inflammatory properties. Okay, and what omega-6s and omega-3s do when they're in the body, they go through this pathway to produce what's called eicosanoids. And the omega-6s produce pro-inflammatory eicosanoids. The omega-3s produce anti-inflammatory eicosanoids. Okay, so you're kind of thinking, how do we balance these out? Because they use the same converting enzymes in the body to actually produce these eicosanoids. Okay, so your omega-6s, we still need them because they're really important for that intercellular cement, for the barrier function. But we don't want too many of them because then you get all these pro-inflammatory eicosanoids. So we need a balance of omega-6s for the cement, for the barrier function, combined with omega-3s, which will produce these anti-inflammatory eicosanoids. And what the anti-inflammatory eicosanoids are going to do in the skin is reduce itching, reduce inflammation, reduce the pruritus. Okay, so they're both really important, but they've got to be in the correct balance. So what other nutrients can be beneficial in skin disease? Well, this paper is from 2006 and it assessed the use of 27 nutritional components and their action on skin barrier function. They then went on in the study to use the top 5 and they fed them to dogs over a 12-week period. And the barrier function of the skin was assessed by measuring the transepidermal water loss. And after 9 weeks of this, they actually came up with what's now termed the pinch complex. And it's a patented complex from Royal Canin. And in the pinch complex are pantothenate, inositol, niacin, choline, histidine, and they were all found to give consistent improvement in transepidermal water loss. And it was also found that they had a synergistic action. So the action of all of them combined together was much greater than the sum of the individuals on their own. Okay, so it's a patented complex which is now used by Royal Canin in all of their skin diets. So remember, we're talking about how nutrition can help in dermatosis. Remember, dermatosis refers to any disease of the skin or coat. So you're starting to think, actually, this is a huge, huge number of cases which could benefit from this. So just to summarize, we need to maintain adequate protein amounts, highly digestible proteins. We need to ensure protein is amino acid balanced in order to support the skin. So improving pigment disorders, we need adequate amounts of tyrosine in the diet. We want to improve and support the skin barrier function, so maintain that integrity, stop the water being lost through the skin, stop the allergens penetrating in from the environment. So we need that correct balance of omega-3s and omega-6s to improve skin barrier and manage inflammation and pruritus. And this is where this patented B vitamin and amino acid complex, the pinch complex, contributes to that also. So what kind of dermatosis cases are we thinking of? So, you know, cases of pyoderma, cases of ringworm, wound management and wound healing, otitis externa, don't forget your ears are just an extension of your skin, pigmentation defects, and atopy also. So, as we said, the two diets that we're really looking at the moment are skincare on the dog side and skin and coat on the cat side. So skincare comes in several different varieties. So we have got the regular dog skincare, we've got a small dog skincare, and we've now got a puppy skincare also. On the cat side, we have skin and coat, and this is available both in dry and in wet. As you said, the skincare for puppies is a relatively new diet. It has all the benefits of skincare, all those generalized benefits that we've been talking about when thinking about nutrition in dermatosis. It supports not only the skin, but it also supports appropriate growth for puppies. So it's got the correct balance of calcium and phosphorus, an increased density of calories, and an appropriate amount of protein to support growth. So moving on, how can we use nutrition to help us with cutaneous adverse food reactions? So let's just look at those two definitions. Again, an adverse food reaction is an abnormal reaction to food or a food component, and it can be immune or non-immune in origin. And a cutaneous adverse food reaction, so we're thinking about food allergy or food intolerance, is a non-seasonal pruritic skin disorder of dogs and cats associated with the ingestion of a substance found in the animal's diet. Okay, a couple of things to note then. Firstly, the word non-seasonal, okay? It's going to be a non-seasonal reaction because it's going to go on every single day that the animal gets fed their food. Okay, so if you think about some atopic dogs, if they're allergic to, say, grass pollens or something, you will get a seasonal sort of distribution of the appearance of the disease. If you are thinking about food reaction, they get fed the same food every day. It's going to be throughout the year. The other thing to note is that an adverse food reaction can be both immune and non-immune in origin, okay? And so because it can have a non-immune origin, serology is not helpful in diagnosing adverse food reaction, okay? So just worth thinking about that. Now, obviously here we're talking about cutaneous adverse food reaction. Strangely, the most common symptom in a food reaction is skin disease. And it's similar in humans also. So whilst you think, oh, if you're reacting to your food, surely it's going to be your guts and you're going to get GI signs, vomiting, diarrhea. Strangely, no. Yes, you do sometimes get GI signs, but the most common symptom is itchy skin. So you're thinking hives, itching, potentially secondary pyoderma. So really important to understand that food reactions can give GI signs, but they more commonly give cutaneous skin signs. So when we're thinking about cutaneous adverse food reactions or adverse food reactions, what we're looking at is this set of diets. So these are the hydrolyzed diets, okay? Similar in cats, we've got the same three diets: analergenic, hypoallergenic, and sensitivity control. And let's talk a little bit about what hydrolyzed diets actually are. So hydrolyzed diets we use in the control of food allergy by decreasing the exposure of cats and dogs to allergy triggering proteins. So we know that allergens for dogs and cats tend to be proteins, and they tend to be proteins of animal origin. And the size of the protein is closely linked to its allergenicity. So if you remember when we were talking about digestion last week, we were talking about how proteins get broken down from proteins to peptides to small peptides to amino acids. The larger the protein, the more allergenic it is, the more likely animals are to react to them. As they get broken down into amino acids, these are much less allergenic, okay? So if we can feed animals a diet with much smaller protein molecules in, it will be much less allergenic. They will be much less likely to have an allergic food reaction. When we think about what the top three allergies in cats and dogs are in Europe, the top one is flea allergy. Secondly, it's food allergy. And thirdly, it's environmental or airborne allergy. As we said earlier, we don't have too much of a problem with fleas in the Middle East. So because fleas like warm, damp, shady places to develop in the environment before they hop on the dog or the cat, we don't have so many of those in the desert. So because of that, if we're almost discounting flea allergy a little bit, the most common type of allergy you'll probably see in the Middle East in veterinary practice is food allergy. It's much, much more common than what we originally thought. So looking at analergenic, analergenic is our most hydrolyzed diet. So it's got oligopeptides in, so low molecular weight peptides, and these reduce the risk of nutrient intolerance, reduce the allergenicity of the diet. In addition to that, the formula and the production process are actually aimed at excluding sources of food allergens as well. So the production line is actually designed to minimize contamination. It's regularly washed and it's regularly tested. It's got the skin barrier formula as well. So it helps protect the natural skin barrier for optimum skin health. And then along with that, the antioxidant complex, which helps reduce and neutralize free radicals, which can cause inflammation in the skin. So your skin barrier, remember, that's your pinch complex, your omega-3s, your omega-6s. And this is the diet that we would choose for elimination diets. Because if you take the least allergenic diet, you'll be most likely to identify most food allergic animals, okay? The diet is formulated with feather protein hydrolysate. So it's feather proteins which have been broken down into either free amino acids or very low molecular weight oligopeptides. And it is the purest elimination diet in the market, okay? So it will capture the greatest number of food allergic animals if you do an elimination diet with analergenic. They found that when you break down and hydrolyze proteins, it actually reduces the palatability of them. So analergenic, because it's so far broken down, there was a worry that it might be not as palatable as other diets. So what Royal Canin have done, they've put in a specifically designed palatability enhancer. And it's actually found to now be a perfectly palatable diet. Yeah, we don't get feedback from owners, from vets in practice, that animals don't want to eat it. So it's actually a very palatable diet. As we said, it's got that pinch complex, the antioxidant complex, for skin barrier function and to reduce free radical damage and inflammation. And as we said, it's a manufacturing and production line which is designed to minimize contamination. So it's a washed line, it's a tested line. This is one of the reasons why the major feedback that we get, or the major complaint about this diet, is that it's very expensive, okay? There are a couple of reasons for this. Obviously, the hydrolyzation process, so it's a very processed diet. The other reason is that it's periodically DNA checked to check for contamination, to check that the protein sources have not been contaminated, and to check that it hasn't been contaminated in production as well. Okay, so when we're thinking about this diet and thinking about prescribing it for an elimination diet, have in your minds that it's equivalent to a medicine, yeah? Rather than food, think of it as a medicine, and in your mind, that might help to sort of justify the cost a bit more and help to sort of explain it to the owner as well. Because once you've gone through an elimination diet, it is not necessarily analergenic that you have to stick with. So to go on and look at another of the hydrolyzed diets, hypoallergenic, again available for both dogs and cats, and we would consider this a highly reduced allergy diet. So the proteins in it are hydrolyzed, they're from soy protein. It's low molecular weight, but it is not as low as analergenic, okay? Again, the skin barrier function, it's got EPA, DHA or omega-3s, and then again, nutrients to support digestive health as well. So when we're thinking about how big are the molecules which actually produce allergy, food allergy in dogs and cats, the most common allergens are of this size, between 15 and 40 kilodaltons. So kilodalton is how you measure protein sizes. So 15 to 40 kilodaltons, those are the most common allergies. When we hydrolyze the diets, Hypoallergenic has been reduced down to 3 to 15 kilodaltons, and here you've got reduced allergic risk, but it is still possible to be allergic to proteins of this size. You hydrolyze it further and further until you get to less than 1 kilodalton, and this is highly, highly unlikely to produce allergies. Okay, so an allergenic, 99% are less than 1 kilodalton, and 100% are less than 3 kilodaltons. So you can see it is a hugely, hugely hydrolyzed diet, and it has got very, very low allergenic potential. And as I say, it's because of that, because it's got such low allergenic potential, that's why it will capture as many food allergic animals out there if you use it for your elimination trial. So to go on and look at a few publications which have come out about the use of elimination diets in cutaneous adverse food reactions. This is a series of open access publications, so you can just get them, read them for free on the internet. They are literary reviews which have been done by 2 dermatologists. So the dermatologists are a chap called Thierry Olivry, who is based in the States, and Ralph Muller, who was originally in the States, is now based in Munich. And the objective of them was to review existing knowledge and dogmas on adverse food reactions in dogs and cats. So looking at all the scientific evidence available, they've reviewed it and produced a series of critically appraised topics, or CATs, which will hopefully debunk some of the veterinary dermatology misconceptions surrounding food allergies. So the first topic that they looked at was the duration of elimination diets. How long do we need to put an animal on an elimination diet before we can positively say this animal has got an adverse food reaction? 80% of dogs they found improved after 5 weeks, okay? And they found that cats improved after around 6 weeks. 90% will improve in 8 weeks. So it's a shorter duration, I think, than what we originally thought. So 80% of dogs, you will have seen an improvement after just 5 weeks. After this time, they still are recommending provoking either with individual proteins or with the previous maintenance diet. You provoke them, and then within sort of 2 or 3 days, you assess whether the clinical signs, whether the pruritus has returned or not. If you do this with individual proteins, so try and provoke them just by feeding them an allergenic and then a bit of chicken on the side, you can then actually identify what protein it is specifically allergic to. Once you've done that, it can help with your choice of maintenance diets. The second topic that they looked at was common food allergen sources in dogs and cats. They found, as we know, most allergens are animal protein sources. In dogs, they found beef, dairy, and then chicken. And in cats, they found beef, fish, and then chicken. And they do actually see geographic trends as well. So I believe in New Zealand and Australia, you get more lamb allergies than what you do in the rest of the world. And it's just basically to do with which are the most common types of proteins which are being fed. They found that cutaneous adverse food reactions is estimated to cause between 20 to 35% of skin conditions in the cat and dog. So that was looking over all of the published data, and they found that was the range. Up to 35% of skin conditions in the cat and dog are probably cutaneous adverse food reactions. When we think about the age of onset, I think we typically, or I certainly did, used to think of adverse food reactions occurring in younger animals. But they actually found the range was between 1 and 13 years of age. So do not discount an animal from this diagnosis just because of its age. You tend to see a non-seasonal pruritus. As we said, it's really, really important to remember that non-seasonal pruritus, so just itching all year round. In terms of breed distributions, German Shepherds, West Highland White Terriers, Labrador Retrievers, Golden Retrievers made up 40% of the affected dogs. And so if you look at those breeds that we've got there, those breeds overlap hugely with the breeds that we typically see with atopy as well. We found that dogs suffered with generalized pruritus, recurrent bacterial infections, otitis externa, and concurrent atopy. Cats, pruritus, self-trauma over the head and neck, plus eosinophilic lesions, they were the most common presentations. So you can see on the two diagrams, obviously on the dog diagram on the right, the red spots are the typical itchy places and the typical places that dogs have a real go at itching. Cats, the blue bits are the bits they leave alone, the yellow bits are the intermediate bits, and the red bits, so you can see it's their head and their face, where they really feel the pruritus. Another article that they have, or review that they've done and written up into an article is, can we diagnose adverse food reactions in dogs and cats with in vivo or in vitro tests? And they were looking at 22 articles assessing serum IgG and IgE. They're also looking at intradermal testing with food antigens, lymphocyte proliferation tests, fecal food-specific IgE, plus gastroscopic and colonoscopic testing. 22 articles, so it's a huge amount of data there. And the end result was that serum testing for food-specific IgG and IgE showed low accuracy and low repeatability. Okay, so the bottom line is, it doesn't work, it can't be trusted, don't do it. Okay. When we think about intradermal testing is quite interesting because it actually provides a high negative predictability. So what does that mean? It basically means if an animal doesn't react, then you can be fairly sure they're not allergic to this thing. Okay, so it could be good for choosing an elimination diet because you know which things the animal definitely isn't allergic to. However, it doesn't work the other way around. So if you get a positive result on intradermal skin test, they might not actually be allergic to this. Okay, so it's got a good high negative predictability. So you can trust the negative results, but you can't trust the positive results that was found. Gastroscopy, colonoscopy, they show no correlation to symptoms whatsoever. It's a waste of time, it's a waste of money, don't do it. So our final diet, which we think about in terms of adverse food reactions, is sensitivity control. So this diet is hydrolyzed, but not to the extent of the other two diets. It's a good choice after your elimination trial if the owners actually trial different protein sources and know what protein the animal is actually allergic to. So what this is a selected protein diet, essentially. It's got all the same skin support functions, the skin barrier, your omega-3s, antioxidants, and your pinch complex in as the other skin diets do, but selected protein. So it's a good choice, as I say, to use as a maintenance diet once you've diagnosed your adverse food reaction and once you know what the animal is potentially allergic to. So because in these diets, what you've got, your protein sources for the dog are duck and chicken, and for the cat are duck and chicken. Okay, so what you can do is obviously test the animal with duck, test the animal with chicken. If they're not allergic to those, if they don't relapse in terms of clinical signs and pruritus, then this is a great diet to choose. So finally, we're going to think about how nutrition can help in cases of atopic skin disease. So what is atopic skin disease? It's a genetically predisposed inflammatory and pruritic allergic skin disease, often associated with a production of immunoglobulin E against environmental allergens. It tends to be a diagnosis of exclusion. The pathogenesis isn't completely understood. It is multifactorial. So genetic factors, we know there is a breed predisposition. The overrepresented breeds are here. So your German Shepherds, they seem to be overrepresented in every single disease process, your Labrador Retrievers and your Golden Retrievers as well. We know these dogs have got a skin barrier defect and they tend to have an altered skin immune response as well. And canine atopy has actually been studied quite a lot, quite usefully for us vets, because it's used as a model for human skin disease or for human atopic disease. So yeah, humans get atopy as well. And if you just look in the definition, a production of immunoglobulin E. So because it's IgE mediated, serology tests can actually be useful in atopic cases, okay? Particularly when you're looking to use desensitization injections to improve their clinical signs. So as I say, canine atopy is often used as a model for human atopy. And also sort of vice versa as well. So we can take some findings from human atopy research and actually apply them to sort of canine atopy. And it's been found that transepidermal water loss, TEWL, is greater in atopic skin than in normal skin. Okay, so the evidence suggests that alterations in water loss in areas are both lesional and non-lesional. So it's in the normal skin and it's in the itchy bits of skin in dogs with atopic dermatitis. So it's not just a focal abnormality, the skin is abnormal all over the dog or the cat. Atopic dogs are found to have anomalies in the amount and composition of the lamellar lipids in the cement. So remember we said they've got decreased ceramide. So this is what we're talking about here. All of these bits. And you remember our picture of our brick wall, which looked a little bit like it was falling down and not looking so strong. That's what the stratum corneum probably looks like in these animals. The morphology, the shape and the build of the epidermis is also affected. So you're talking about the cornea sites as well, how they all fit together. It's probably looking like I built the wall rather than a good brickie did. Inflammation is also associated in increases of transepidermal water loss. So what you get, the inflammation in the skin also breaks down the barrier further. So you're going to get increased water loss. You're also going to get increased penetration by the antigens, or allergens rather. So it's a vicious cycle. And what's also been found is that atopy predisposes to developing allergies in the future. Okay, so we've got to think about the role of hydrolyzed diets in maintenance because they may be useful because these animals may be potentially becoming food allergic in the future. And it's also hydrolyzed diets are good for reducing the allergenic burden. But we're going to discuss that more in just a minute. So how can nutrition help? Well, the first thing is improving the skin barrier function. So stopping the transepidermal water loss and stopping the penetration of allergens from the external environment. So we're thinking about that balance of omega-3s and omega-6s. So omega-3s to reduce inflammation, the omega-6s to improve the epidermis and the cement in the epidermis, so improve that barrier. And then, as I said, also, we can use nutrition to reduce allergenic pressure. So this is quite an interesting diagram. This shows, there's my arrow there, environmental allergy, okay? These are our atopic dogs. You can see there is an overlap between those dogs which have got atopy and those dogs which have got food allergy. It also overlaps with flea allergy as well, but we'll mainly focus on this one. So just because you're just allergic to environmental allergens, you can also be allergic to food allergens as well. And there's a proportion of dogs which are. So why is that important? When we're talking about reducing allergenic burden, what does that actually mean? Well, it's reducing the things that the dog has in its life that it's going to react to, that its immune system is going to overreact to and is going to make it itchy, okay? So if we think of each dog as having what we call a pruritus threshold, and underneath this, they're asymptomatic. But if you build up enough allergens in the dog's life, eventually you hit this pruritus threshold and then they get itchy, okay? So what we want to do is take out some of the allergens in the dog's life. So decrease the stimulation of the immune system and hopefully stop it being itchy. So if we look at this first graph, dog number 1, if we feed it a hydrolyzed diet, we've reduced the allergens it's getting from its food, okay? By doing that, by taking out the allergenicity in its diet, making sure its food is not something its immune system is worried about, you can actually decrease this dog below the pruritus threshold. And this was dog 1. This is predominantly allergic to airborne things. Yeah, but you can't change the dog's environment particularly, you know. So you have to focus on the things that you can change, of which food is one of them. Okay, if we look at dog number 2, this one is predominantly allergic or stimulated by its food. It's also a little bit allergic to fleas and a little bit allergic to airborne allergens. Again, if we feed it a hydrolyzed diet, a hypoallergenic diet or analergenic, you take out all that stimulation from the food and you drop it way down below its pruritus threshold, the dog becomes asymptomatic. Finally, the flea allergic animal, the same principle. Okay, so you can think of it as allergens can be cumulative. Okay, so you can have airborne allergens, flea allergens, food allergens, all building up and then tipping the dog over the pruritus threshold. If you can take away some of those allergens, i.e. by changing it onto a hypoallergenic food, you reduce the dog below the pruritus threshold. So it can be quite strange in that whilst you've got a dog, say number 1, who is predominantly an atopic dog, so it's showing seasonal pruritus, we've changed its food and strangely cured the atopy. Okay, so it can appear quite strange, but this is the principle behind it. So finally, let's just think about our key messages for today. Hopefully you start to understand that nutrition is relevant in every single skin case, okay? Food allergies are not rare, yeah? It can be up to 35% of skin cases have food allergies, okay? Elimination diets are the only way to diagnose cutaneous adverse food reaction, and IgE analysis is irrelevant for food allergies, okay? Save your clients money, save yourself the time. Do not do IgE serology for food allergies. Remember, cutaneous adverse food reaction and atopy are not mutually exclusive. You can use food to help reduce atopic dogs down below their allergenic threshold, their pruritic threshold, and actually really improve their clinical signs and their itching. Remember, grains do not commonly cause allergies. I'm thinking about gluten, which is a wheat protein. It does not cause allergies in dogs and cats. Yeah, this is a thing of humans, and it's actually much rarer in humans than what people would have you believe as well. Home-prepared diets, novel protein diets are not preferable to hydrolyzed diets, okay? They're not as balanced. They don't have the additional benefits of the pinch complex, so your skin barrier complex, your omega-3s, your omega-6s in the good balance. And then they've also got the potential worry of contamination with other protein sources, okay? So hydrolyzed diets, and it comes straight out of the bag, it's much more reliable, it's much more balanced, it's got much more additional micronutrients, which are there to support skin function than what any home-prepared diet or any sort of novel protein diet, which you can buy off a shelf, will do. These, as ever, are our list of references. You will get sent, as ever, a copy of this presentation, so you can have a little look back through it at your leisure or for reference. So feel free to have a look up at some of the references. These ones, the cats, the critically appraised topics on adverse food reactions, as I say, they're available for free online. They're really good little publications which cover a huge amount of ground in terms of cutaneous adverse food reaction. As ever, any questions, we are always available on any of the email addresses below or on the phone. And if you do have time, have a little look. There are a couple of nice articles on cutaneous adverse food reactions and nutrition in dermatosis on our SV Animal Health blog. Okay, so similar information to what I've just given you, perhaps in just a different format, might help it just sort of sink in that little bit better. It's always good to have a sort of multimodal approach when we're trying to learn. I hope you have enjoyed today. I will see you back same time, same place next week for a final Nutritional Ambassadors course. It will be renal disease and nutrition next week. In the meantime, have a great week and I will see you then.